You know, during pregnancy, something truly miraculous is happening. A tiny heart is forming, literally growing from just a couple of cells into this powerful little engine that will sustain a life. It's an incredibly complex process. And today, we're going to talk about a remarkable tool that gives us a window into that development, a way to see the unseen. So let's dive in.
So it all comes down to this really fundamental question, right? When you have something so vital, but so tiny and completely hidden from view, how on earth do we get a clear picture of it? How can we really know that a baby's developing heart is on the right track?
Well, the answer is a specialized procedure that acts like, well, a window straight to the heart. So let's break down exactly what this scan is and how it works.
Okay, at its core, the fetal cardiac anomaly scan is a type of ultrasound. But the two words you really need to focus on are specialized and targeted. That's what makes all the difference here. This isn't just a quick look. It's a super detailed evaluation of the baby's heart structure, and just as importantly, how well it's all working.
So you might be thinking, wait, don't I already get an anomaly scan? And you do. But think of it this way. A routine scan is like taking a wonderful family photo of the whole baby. You get a great overview. But this scan, this is like bringing in an expert architect to examine just one room, the heart, in microscopic detail. It's a deep dive, focusing exclusively on that one crucial organ.
And the level of detail they get is just incredible. They look at the physical structure, the chambers, the size, the valves. But it's more than that. They're also checking its performance, watching the blood flow patterns, listening to the rhythm of the heartbeat, making sure everything is pumping efficiently. It's basically a complete functional checkup all before the baby is even born.
All right, so now we know what the scan is. But honestly, that's only half the story. The really important question is why it matters so much. And it all comes down to the power of knowing things early.
And the benefits here are just profound. Finding a congenital heart defect, or a CHD, before birth is a total game changer. It means the delivery can be planned at a hospital that has a specialized cardiac team ready and waiting. For parents, getting this information, even if it's tough, can actually reduce a ton of stress because it replaces the unknown with a clear plan. It's all about being prepared and improving a baby's chances from day one.
So naturally, you're probably wondering, is this scan for everyone? Who is it that's typically recommended for this kind of detailed look? Well, there are a few common reasons a doctor might suggest it. Maybe a routine scan flags something that needs a closer look, or there could be a family history of heart conditions. Other things, like certain medical conditions the mother has, or even having an IVF pregnancy can be factors. But you know what? It's not always about a suspected problem. Sometimes families choose to have the scan simply for that powerful peace of mind that comes with knowing everything looks great.
Okay, so let's say you or someone you know is going to have the scan. What is it actually like? Let's walk through the whole experience just to demystify the process. First things first, timing is key. The ideal window for this scan is between 18 and 24 weeks of pregnancy. That's really the sweet spot. The baby's heart is developed enough to see everything clearly, but there's still plenty of room for the sonographer to get the perfect angles.
The procedure itself is really straightforward. It feels a lot like a routine scan and usually takes about 30 to 45 minutes. But here's the crucial part. What happens after? Those images don't just go into a folder. They're reviewed in detail by a pediatric cardiologist, a doctor who specializes in children's hearts. And then the team sits down with the family and explains everything, making sure everyone is on the same page.
Of course, with any procedure during pregnancy, the single most important question is always going to be this one. Is it safe?
And the answer is a clear, definitive yes, absolutely. This scan uses the exact same standard ultrasound technology that's been used safely for decades. It's totally non-invasive, nothing enters the body, and there is zero radiation involved. It is completely safe for both mom and baby.
So all of this brings us to the ultimate goal of the scan. See, it's not just about getting information. It's about turning that information into action, into a real plan for a healthy start.
And this, I think, is the biggest fear that comes with any detailed medical test, isn't it? What happens if the news isn't what we were hoping for?
Well, if an issue is found, the most important thing to know is that you are not alone. A finding like this isn't an endpoint. It's the start of a coordinated plan. The medical team is there to guide the family every single step of the way, from confirming the diagnosis, to planning the delivery, to organizing whatever care the baby might need after birth. It's all about support and preparation. When you really boil it all down, the entire purpose of this scan can be summed up perfectly with this idea: giving families the clarity they need as early as possible. That's it. It's about taking away the uncertainty and creating a clear path forward.
So I'll just leave you with this question to think about. What could that early clarity, that clearer picture, mean for your family's journey? Whether it's the peace of mind that comes from good news or the incredible power that comes from being prepared with a plan, seeing that tiny heartbeat clearly can truly make all the difference in the world.